What should be done to my face to maximize results? 52 years old, no prior work. Really tired looking due to eyelids, heavy folds, and tear troughs. I'd love to know what needs to be done over a period of time, slowly, not to expose my vanity. Would greatly appreciate doctors' ideas.
Thank you for your question. You're 52 years old and you have submitted several very good photos from different angles of your face. And you expressed in your question that you're 52 years old and you have, you're concerned about your eyelids and your tear troughs. And you want to get a general plan on how to address your appearance. Well, I can certainly share with you my perspective. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. As an oculofacial plastic and reconstructive surgeon, my original specialty prior to training in cosmetic surgery was in eye surgery. So, as you can imagine, I do a lot of cosmetic surgery for eyelids and the cheek area and work around the eyes. And I've been very active in advocating a natural look, and I think that it's very important, particularly for men, to retain a natural look. So one of the things that I would first mention to you is that when you ask an open-ended question like this, you're basically asking what is the surgeon's aesthetic sense about your look and what would be ideal. And most of the time it really is, or I should say all the time, it really is about a conversation and a dialogue with a doctor. So although certainly I can point out to you different things that I would see as opportunities to help you look better, so much more depends on what are your priorities. Yes, you've expressed that you have concerns about your eyelids and your tear troughs. So let's begin with that. When you look at your face, what impression would one have once one looks at you? I think it's reasonable to say that someone looking at you would say you're tired. And this is what I've been hearing for over 20 years in practice. I've been in practice in Manhattan and Long Island for over 20 years. And when it comes to eyes, people always say they're tired of looking tired. So when you think about what is it about your face that make your eyes look tired, well, yes, part of it could be the upper eyelid hooding. Yes, there is volume loss under the eye in the tear trough area, but I think you can also appreciate from the 3/4 views of your face, there's also a lot of volume loss in the cheek area. In my practice, what I do first with the patient like yourself is go over the different things that we can do, but I would probably advise a combination approach for you. Let's start with the upper eyelids. Yes, what we can do is conservatively remove a little bit of skin to just show off a little bit more of the eyelid, but I would caution you that in men in particular, it's very important not to take away too much skin. This is one of the telltale signs that someone has had eyelid surgery. A lot of times in our field, we refer to it as a feminizing effect. I would actually go further. I would say it has actually an aging effect. If you take away too much skin and fat, a person doesn't look better for particularly men when there's nothing in the upper eyelid if they never had, that wasn't a natural trait for them. Now in the lower eyelid in the tear trough area, there are more than a few opportunities, and of course a physical exam would elucidate whether or not there's any under eye fat prolapse. And as far as the hollowing in the tear trough, in our practice we routinely combine a hyaluronic acid filler like Restylane combined with platelet-rich plasma to improve both the volume in the tear trough as well as the skin quality. Platelet-rich plasma is derived from your own blood and is used to help stimulate collagen and blood supply and help improve skin quality. Now it's very important to actually understand, and this is my next point, is that the cheek area really supports and frames the eyes. So when I look at somebody, I don't just see their eyes, I see the cheek and the rest of their face. I'm also board in cosmetic surgery. I do a lot of facelifts, volume augmentation in the cheeks, chin implants, etc. So when I look at someone like yourself, I also think of structure. And the structure in your face, if you look at it, it has kind of flattened out. There's a lot of fat volume loss as well as some bone loss. So we would use a method to actually place volume in the cheek area to help give you more support around the eyes. So there is truly an art to doing this. Now, much of this procedure, when it comes to eyes, is performed in our practice under local anesthesia with light IV sedation. That means you avoid general anesthesia and you're able to recover a lot faster. This has been a winning formula for us for over 20 years. I can also concurrently, or I do this for a lot of people, I will actually do injectables at the same time. So essentially, they go in for one thing, they get a lot of things done together, but at the same time, they're not adding any downtime in addition to their procedure. So I would recommend that you meet with qualified and experienced cosmetic surgeons and learn about your options. I can promise you, when you meet 5 doctors, you will get 5 different opinions. So what you have to do is get a sense and feel and resonate and see if you resonate with the doctor that you're considering. And then once you feel like there's a good connection, move forward with your plan. So I hope that was helpful. I wish you the best of luck. And thank you for your question.